We've all been on a path of change and adding virtual and digital solutions into our daily lives, but the amount of change that's occurred in the last 8 weeks is staggering, and it's definitely not been easy, and our clinicians still continue to provide excellent care, and for that I'm grateful. We quickly learned that the top priorities across the clinical programs were the ability to do virtual visits, one-to-one, one-to-many, the ability to talk, chat with our patients and our other providers, the ability to offer online treatment, and to provide remote patient monitoring. Understanding our clinical needs helped us select a few virtual solutions, and then we collaboratively began to integrate and implement them at the point of care. Virtual health doesn't have geographic boundaries. Our patients and providers travel, and we wanted to be able to bring the care to the patient wherever they may be. What's happened the last 8 to 12 weeks is unprecedented. It's proof of collaboration and teamwork. In March, we, the network of leaders, started to meet, and over March 14th, 15th weekend, over that weekend, we created a virtual health toolkit. That toolkit was made available for all the regional health authorities. And then we identified solutions that were endorsed by PHSA and the ministry, and they were available immediately. There were solutions that people had on their phones. They were solutions that patients knew how to work. They were Skype, Zoom, text messaging. The vendors were offering free licenses to help us implement this quickly. We created guidelines for each solution on easy how to use these. And we were able to put all this on our website for everybody to access. And we were able to do this because we had relationships with corporate communications. We asked for help, and in a heartbeat, they created a new website, the new website pages we needed. Within 1 week, our website views went from 90 a week to over 4,000. And after 1 month, our views went from about 300 to 15,000. Because we were able to respond so quickly, we've actually been asked to support other organizations with their Zoom management, including Doctors of BC, HealthLink BC, Vancouver Island Health Authority, and Providence Healthcare. And now just a couple quick facts. Provincially, we have provisioned over 18,000 Zoom licenses for healthcare. In early March, across the province of British Columbia, we were doing about 1,300 virtual health visits a week. This past week, we conducted over 14,000. At PHSA, we went from doing about 1,000 virtual health visits a month to now we're doing 1,000 virtual visits a week, and this increases every day. So what does all this mean, all this work and all this planning and all this mobilization? What are the real stories? How does this impact patient and provider care? Since tracking their virtual health visits on March 23rd, the community paramedics have done close to 4,000 virtual visits. At BC Children's, within 1 week, the neurology clinic switched its appointments from in-person to virtual. And anecdotally, the feedback from families is it's 100% positive. Families don't travel, it decreases their exposure to COVID-19, they don't pay for parking, their appointments are faster and on time, and the experience for children is much better because many of them are afraid of the hospital. BC Cancer a year ago was doing about 6 to 7% of their ambulatory care visits virtually. Same time this year, they're doing anywhere between 70 and 90, depending on which center you're looking at. At BC Women's, we have a diabetes and pregnancy clinic, and they have a remote patient monitoring, and they had 60 patients. But with COVID, we were able to open it up to everyone and have over 150 patients enrolled in that now. TransCare's integrated virtual health in all aspects of their service offering, ranging from pre-surgical assessment, follow-up to voice feminization training. They've done 176 virtual visits and reached as far north as the Yukon. At BC Mental Health, they created a virtual health task force to ensure clients receive care and physicians and psychologists are able to deliver services via virtual health. Those are just a few of the examples. We actually hope to document more stories and share those with you at a future date. And our goal continues to be that virtual health will be a standard method of care delivery across BC.